right, everybody. Welcome to the Scope podcast by the Ohio Council for Home Care and Hospice. This is your host, Joshua Wagner. I'm the Director of Marketing and Communication for the Ohio Council for Home Care and Hospice, and I am joined today by the one and only Joe Russell, who is our Executive Director.
Hello,
How you doing,
hello.
Joe?
Excellent. How are you?
All right. It's always great to have you here, the little rock'em sock'em duo that we have. We have a great episode for you today. We have one of our platinum sponsors with us, Axxess, and we are joined by Tammy Ross. We'll talk about Tammy here in a minute, but Tammy is the Senior Vice President of Professional Services for Axxess. This episode today, we're going to be talking about something very interesting, which is PDGM. If anybody's ever heard of that in the industry, you ever heard of that, Joe?
I've heard of it.
Yeah, it stands something about plaid dogs go mad or something like that. I think that's what the acronym means. So we'll get a little bit into the PDGM, specifically staffing challenges, with Tammy Ross, the Senior Vice President of Professional Services for Axxess. And we'll meet her in just a second. Before we begin with the whole episode, I just want to thank a few of our sponsors. We have two diamond sponsors, Medline and National HME. Medline strives to help healthcare providers achieve both clinical and financial success in an environment that demands lower costs and better outcomes. They do this through a personalized approach. Our other diamond sponsor is National HME. National HME is a technology-enabled durable medical equipment company focused on the hospice provider and the patients they serve. Joe, did you know we also had two platinum sponsors?
I do.
We have Axxess, who of course we're joined by today. Axxess is the fastest growing home healthcare technology company, providing solutions that improve care for more than 2 million patients in North America and are trusted by more than 7,000 organizations. That's a pretty impressive rap sheet right there. And then Allura is our other platinum sponsor. Whether you need software for home health, private duty home care, personal care, hospice, or pediatric home care, our core promise is to make it easier for your agency to perform better. So I'd just like to thank our diamond and platinum sponsors, Medline, National HME, Axxess, and Allura.
Yes, thank you.
Into this episode. Yes, great, thank you. So Tammy Ross is a Senior Vice President of Professional Services for Axxess. She oversees the Professional Services Division with a focus on practical operational solutions for home health, home care, and hospice sectors of the post-acute care industry using technology. During her time at Axxess, Tammy has implemented strategic directives and developed operational materials to educate the industry on important new initiatives. Tammy, welcome to the Scope podcast. How are you today?
Hi, thank you. I'm very well, thanks.
It's really great to have you here, and we're going to talk about some interesting things about PDGM and staffing and all sorts of fun things in the post-acute care industry and all the places. So I, as we were chatting beforehand, you've been with Axxess for quite some time, or been in the industry for quite some time. And how long have you been?
I have.
And how long
I
have you
have been in the industry almost 30 years now, and I'm still waiting to see those plaid dogs under PDGM. So I'm expecting that any day.
Well, we have a lot of actually around the office here, and I can't say any of them, but we have some creative acronyms around the office here for PDGM as well. I actually don't remember most of them because I'm still trying to figure out what PDGM actually means. I'm pretty new to the industry, but we have some pretty creative acronyms.
Yeah, we're actually creating a list, so maybe we'll publish the list someday, or at least the ones that we are allowed to say publicly, but that would be a fun project. Maybe we should get submissions.
I think so.
Yeah. But for now, it's plaid dogs go mad. So that's what it is for today. So how's the weather? As we're recording this, it's the end of February of 2020, and we have a little bit of snow on the ground here in Columbus, Ohio. How are things in San Antonio?
San Antonio is sunny but cold for us. We're probably only going to hit the mid-60s today, which is kind of unusual for us here.
So I told you we should have recorded the podcast in San Antonio, Joe. We could have gone down there. Mid-60s is cold for them.
Yeah.
We would be in shorts and flip-flops.
All right, Riverwalk. I mean, right?
Yeah, I love the Riverwalk. I do have one question for you. Do you remember the Alamo?
I do very well. I've been in the home care industry almost long enough to remember the Alamo.
It's funny. One of my favorite films growing up, I'm gonna date myself here, was Pee-wee's Big Adventure. And of course, Pee-wee's Big Adventure, Pee-wee Herman, he has to go find his bicycle, and the soothsayer tells him it's in the basement of the Alamo. And then he gets to the Alamo, and there's no basement. And so I remember when I visited San Antonio, I think I was about 13, so it wasn't that long after that movie came out, and I kept asking where the basement was, and they kept asking me why. why I wasn't leaving.
Cute.
That's like
Yeah.
in high school, they'd say, yeah, the pool's on the roof. You take the elevator to the roof. And, of course, there's no pool and there's no elevator.
And there's no roof, yeah. Well, so let's get into the heart of this, Tammy. It sounds like you have tons of experience with this, and we're going to talk about a couple of different things, and Joe and I will both ask you a couple questions that we sort of discussed beforehand. But let's get into the heart of this. Can you talk about the changing workforce landscape and the demographics supporting the need for post-acute care, and what kind of transferable skill sets should agencies consider for recruitment and retention?
Yeah, so I think the first thing we have to talk about is what's happening in front of us is kind of that silver tsunami, the gray and tsunami. It's just the rate of our senior. That's going to double between 2018 and 2060. 1 in 5 Americans are going to be over 65 by 2030, which is about 85.5 million people. When we're looking at that, and we're also coupling that with the increased life expectancy for both men and women. Women are about 81 life expectancy, men are 76. What we're also seeing is people aren't only, there's not only more of us, I'll put myself in that baby boomer population that's creating that tsunami, but we're also living longer. The longer we live, obviously, for the most part, the longer, the better chances there is for us to have more comorbid diseases, more things that need to be treated by healthcare. So we've got that going on with our population kind of surge towards the Medicare population. And just as a trivia question, anybody know what year Medicare was enacted?
1965.
Yeah, good year. That's the year I was born. I can remember that. 1965. So, yeah, Medicare started in 1965, and it was really never meant to take on as much as it is now and handle the numbers that it's handling. So we're seeing changes in the way Medicare is administered so we can take care of all these people that are even sicker than they were back when we started Medicare in 1965. So let's think about that on one section, and on the other side, let's think about registered nurses today. Guess what's happening to them? We're aging as well. Many of us are in that silver tsunami that I can just see coming in, like a big wave. There's about 3.8 million registered nurses. Only about 85% of those are practicing nurses. And out of that 85%, 53% of those are over 50. So when we look at that and we start looking at, hey, these people are going to start retiring. Who's going to backfill that? We're seeing about 70,000 nurses estimated to retire annually. That's a lot, right?
That's a lot.
Yeah, so when we're looking at that, and then we're looking at the average tenure of a nurse in home care post-acute, only 19 months. So we're overturning these nurses quickly. I think there's a lot of reasons for that. I think the drives involved in home care, hospice, that has a part to do with it. A lot of times technology, older nurses aren't as familiar, and I know I'm stereotyping myself, but there's reasons for that. Our eyes also go bad as we start to age. And we look at the fact that replacing these nurses costs an average of $52,000 to replace one RN. It takes us about 3 months to recruit them. And then on the flip side of that, we're looking at a millennial workforce everywhere else besides post-acute, and we're trying to attract these millennials into the post-acute industry. So we have a lot going on right now that we're thinking about in this post-acute area. And we're seeing that there's a huge need for not just nurses, but for orderlies, personal care workers, home health aides. There's a huge need for that. If you look at labor statistics, it'll show you that the fastest growing jobs are these jobs related to healthcare, home health aides, nursing assistants, so forth. So we really have to rethink about extending their skill sets. making sure that they're operating to the top of their licenses, making sure they're trained, making sure that we can attract millennials into our space. It's just sometimes not sexy to be the hospice nurse or the home health nurse. I flew life flight when I first started in nursing and did emergency medicine. So when someone talked to me about home care, I was like, no way. That's where the old nurses go and didn't want to do it. So how are we going to attract these people? How are we going to make these skills seem attractable to a younger generation? And then when we look at people that are starting to lose their jobs, declining workforce, when you look at that labor statistics and you see people like human resource people, those jobs are declining rapidly. Bank tellers, they're declining rapidly. People that work in retail, Amazon ships everything. I'm waiting for it to ship a nurse. That may happen soon. Who knows? Maybe that'll be a solution. But when we look at that, we know these people have skill sets that maybe we can transfer those skills. Maybe they'll make good home health aides. Maybe they'll make good rehab aides because they already are used to dealing with people on a daily basis.
And what you're referring to here, Tammy, is basically customer service, that they're already used to dealing with people in the field. And is that what you're implying? Is one of the biggest skills that can be transferred? Yeah.
Yeah, and that's part of it, right? When we start looking at star ratings, we see that there's a high correlation between outcomes and patient satisfaction. So if you already have people that have good customer service skills, you can train the technical stuff. It's the attitude that's kind of hard to change. But these people in these workforces, they already have that skill set. So I see the fact that we're going to start recruiting from those industries and kind of expanding the level of our license, working people to the top level of their certifications or license. We're going to have to, because there's not enough nurses to take care of this growing need in the Medicare population.
Yeah, and when you quantify that, on top of what we already know is a workforce issue, it kind of makes it overwhelming. At least it seems that way. So putting on our PDGM hat, what type of skill sets do clinical staff need for PDGM that really might not have been needed in the PPS world, especially for RNs who are generally the case manager?
Oh, that's a great question. So PDGM, PPS, honestly, it's the same skill set, but what we're seeing with PDGM is because there's such a heightened focus, the times have really been condensed because now we're on 30-day rather than 60-day time frames. So those skill sets are someone that's extremely organized but yet flexible, because we never know what a day in the life of a home health nurse is going to be like. We need someone that the form of a final rule, and it really changes things. I've always heard that saying that old trees have deep roots, and we find that often in home care because we do have a aging workforce in the home health. A lot of us have been in it for a long time, and we're used to how it was done 30 years ago, and we still want to do it that way. That's why attracting these millennials that are more open to change, they can multitask quickly, they can switch quickly, is a good idea. It's also, we're going to have to do it if we're going to keep the home health industry alive. That RN especially, they have to be someone that's collaborative. Under PDGM, it's just super important that you be a collaborator and a communicator, and not just with your peer set that might be in the industry, but you have to collaborate with, hospital systems, outside vendors like DME, pharmacy, Meals on Wheels, VA. There's just tons of coordinating that needs to be done. And I think ultimately, you've got to like what you do. You got to see the value in it. It's got to be fun to see someone finally walk again after a stroke. That has to jazz you. You have to feel
Yeah,
good
definitely.
about that.
It seems like there is a lot of opportunities to take what you just said and translate that into a picture that a lot of millennials might like. I mean, a lot of smart workforce development folks are saying that, you know, millennials want to have a meaningful job. They want to see the connecting point between what they do and how that's helping the community. They like flexibility in their schedule. They don't, you know, the days of kind of going to the same job and sitting behind a desk for 30 years and then you know, building up a nest egg and then retiring somewhere south isn't a picture that vast majority of millennials, you know, might want to see. So do you think there are opportunities to take the uniqueness of healthcare at home and translate that into sort of a picture that could attract more millennials?
We have to look at different type of payment models. You know, a lot of millennials don't want to be full-time. They have a really good work-life balance. You know, that's probably why they're going to live to be 110, 120, right? Because they know how to balance it. So if we're looking at ways that we can flex schedule, it's not 8 to 5. We don't require you to be 8 to 5. We're making it global. You know, you can work in Texas, you can work in Ohio, depending on compact states and licensure requirements. But if we could certainly attract the millennials, but it's up to us to show them that way. And I think the industry, we have a ways to go in paving that path for them still.
Well, so Tammy, I wonder if we can put this into context. I wonder if you could provide like a 5,000-foot overview of PDGM. What is the expanding role for the LPNs, PTAs, and home health aides under this new model, and can you give us some examples of that?
Yeah, so I'll talk a little bit about why PDGM happened. MedPAC looked and they said, you know, there's lower margins being produced for patients that really need a lot of care. Those are the patients that had oral nutrition needs, they had wounds, they were Medicaid, Medicare, they needed assistance in bathing. So when MedPAC looked at those patients, they said, you know what, these patients, agencies aren't really wanting to accept because there's no financial gain, and in fact, there's significant losses. So what they wanted to do is kind of level the playing field. And in order to do that, they set up 30-day payment units instead of 60 days. So now we're getting paid in 30-day increments because they feel like that we're doing most of our intensive services up front. They removed non-routine supply add-on. They changed the way we got paid as far as being primarily driven from OASIS to only the functional items being driven from OASIS. And then they also developed this early and late and community and institutional levels that goes into payment. We used to have 153 different ways to be paid. We now have 432. So if you thought it was hard before under PPS, on 432, it just is mind-boggling, right?
Well, it's almost the number of people that are in Congress, so maybe there is some correlation.
Oh, there you go. Good correlation. PDGM is kind of designed, they said it's designed to be budget neutral and that many organizations would see a reduction, but a lot of them saw an increase. So they wanted something, you know, that's the buzzword. I like you bringing up Congress and that because, you know, keeping everything budget neutral. But when I think about budget neutral, and remember what I said earlier about the growth of the Medicare population, you're keeping something budget neutral, but you have more people eligible for it. So you're really decreasing services. But anyways, they don't like me to split hairs, but that's absolutely true. Budget neutrality means we're not adding any additional money for all these aging people that is coming on to Medicare. So that's kind of the basis of PDGM. Let's pay agencies without incentivizing therapy. Let's put the money where the acuity and when the resources are being spent. So what agencies have in turn saw, many of them, about 40%, saw a decrease in their reimbursement. So what they've had to do is look for more cost-efficient ways to perform that care. And certainly using LPNs, PTAs, CODAs is a lower cost way to deliver care than using RNs, PTs, and OTs. So we're starting to see an increase of that. And then the home health aide, that's absolutely my favorite. I used to actually run a school for certified nursing assistants, and it was one of the probably the most fun jobs I've ever done. And actually expanding that role into the home health environment so they can help with rehab. They can help identify changes in skin integrity, changes possibly that would indicate a need for a nurse to come out, like an increased weight gain. But we really have to build the foundation to work these extenders, these therapy extenders at the top level. So we can't just all of a sudden say, okay, let's put you out here. Now we expect all of this without putting the education behind it and training them first.
Thanks, Tammy. So let's talk about a little bit more about where the rubber meets the road. And what do you think that agencies can do to optimize their scheduling and staffing? And what type of technology should they either be using or start to look at using to make their lives easier in scheduling with PDGM?
Yeah, so I think we really have to first remember nurses aren't computers. So we want to look at technology that works for your field staff. That's huge. We want to look at pay models because, again, we do want to attract, not just the 50-something-year-old nurses that want full-time jobs, but we want to really attract the millennials. And oftentimes having a pay per unit, pay per visit is a really good methodology for millennials because it allows them to be more flexible. It also allows agencies not to have to pay full time when their business has ebbs and flows. We have areas where we're extremely busy, like on Friday afternoon when the hospitals are discharging, and we have areas like Wednesday that there's just not a whole lot to do. So if we can look at supplemental staffing models, that's huge. Also looking at the cost of 1099 employees versus, which is contract staff, using those to supplement versus all full-time staff. And there's a lot of professionals, especially therapists, they like being their own contractors. There's a lot of tax advantages now. There's a new tax advantage for 20% for small businesses that was wrote in a couple of years ago. So people want to take advantage of that. The other thing that I want to highlight is what's coming to Ohio. Actually, it opens live Monday, is Uberization of healthcare. It really is like an experience of taking an Uber. Home health agencies are able to post using a platform, and Axxess has that platform. They're able to post visits where they need help. They need a start of care. They need a resumption of care. And then that connects them with a group of clinicians, PTs, RNs, LVNs, PTAs, and they're able to see that clinician's profile, just like you're able to see a driver's profile. That person is star rated. They've had all their competency checks done. They've had their OIG investigations done. And they're able to say, hey, you know what? I'm willing to pay you X amount. Maybe it's $100 for the start of care. This clinician's able to say, I accept that visit. They connect up and they're able to perform the visit. It's a wonderful way to supplement staffing that ties together the experience very much like the Uber experience, and it connects clinicians all over. We've used it here in Texas for over a year now, and there's been probably 25,000 visits posted and accepted on this platform. So that's a tremendous amount.
Tammy, does that platform exist nationwide or just in Texas?
It's actually in several states. We'll be live in Ohio Monday. It will open up in Ohio, but Texas has it, Florida has it, Illinois has it, California goes live Monday as well. But obviously, our goal is to be live in every state by the end of this year.
So on the this podcast will actually go live on March 2nd. Which is the day that you'll be live in Ohio. So that kind of works out really nicely. and that was a
Oh, that
that was
works
a
out great,
total
actually.
total accident. So by the time you hear this, no matter where you are in Ohio, that Axxess will have. Is that an app that they can download? Is that something they have to sign up for? How do they?
Yeah.
Come Monday when we post this, and of course, if you're listening to this, it's going to already be live and active. How do people get onto this platform as both a provider and also someone looking for providers?
Yeah, so for clinicians, it is an app. It's Access Agency Core. You download that, and Access Care. You will need both Access Care and Agency Core. Download it to your mobile phone. You can find it really easy in the Apple Store. It's a free download. For organizations, you do have to be a customer of Access. We have not opened it up to all organizations yet, but if you are a customer of Access, it's included. You'll see it in your software. It's just a very simple, and we've been sending out a lot of Marketo emails and just notifying them that it's going to be up and live Monday.
So tell me, just before we close our conversation here, what advantages does this offer to agencies that are struggling to maintain staff under more stringent PDGM requirements?
Yeah, thanks for asking that. That's a great question. So it helps you grow specialty programs. A lot of organizations are wanting to grow their wound care programs or their IV programs, but they actually haven't had time to recruit and retain those nurses. So you're able to connect really quickly with staff that already has that skill set. The other thing it does is it reduces your costs. It reduces your costs because you don't have to have that FTE across the board. We're doing less and less visits per rehab now, and especially for therapists, it's huge because the therapist can pick up those extra visits when needed, but yet you don't have to retain a full-time therapist on board all the time. So it's going to dramatically cut costs for agencies. So it's kind of a win-win on each side. You know, nurses were notorious, and so are therapists. We like to pick up that extra spending money for vacation or for, buying the kids' car or whatever the needs are. This is a great way to do that.
That's awesome, and I think it's great that technology is having such a big impact, a positive impact on our industry. We had, Josh, remember that one of our previous episodes, we had learned about the some of the wound care technologies that are out there that's really changing the game. So I wanted to just make mention that you heard it here first, that while there is no Amazon for nurses, there is an Uber for nurses, and Axxess has come up with it. So,
yeah, I think that's exciting, and I think the gig, this sort of gig economy that we have coming up, or that we actively have, I can punch the right places on my screen on my phone, and pizza arrives. Amazing. And I can punch the right places on my screen, and a car arrives, or stuff from Amazon. It's really neat to know that with a few punches on my screen, the home health care people that I need can also arrive.
Yeah.
And I think that's a huge, huge thing. So before we end our broadcast today, I'd like to thank our silver sponsor, Complia Health, who provides software technology for home health, home care, community care, and hospice organizations. Thanks again to our silver sponsor, Complia Health. Joe, do you have any final thoughts or any final words? Tammy, do you have any final thoughts or final words, Joe?
Tammy, I just wanted to thank you for taking the time today. This is very fascinating. We definitely appreciate the partnership with Axxess. I love your crew. You guys do a really great job, and I'm always on the horn with somebody from over there. So I really appreciate all the time you've taken today. Thank you.
Thank you, and thank you for your slogan. We may borrow that from you.
Which slogan?
There is no Amazon, but there is a Uberization.
Yeah, that's good. I think that's very exciting that we're in that age of technology where, even 50 years ago, it would have been just next to impossible to find somebody.
Yeah.
Even 5 years ago, in regards to how easy it is now. And I think that the challenges between, I always think it's very interesting, just as an aside, the challenges between, the three sort of adult generations that we have here, the boomers that are that silver tide that you talked about, my generation, which is Generation X, which we're kind of caught in the middle, and then the millennials, which is a whole nother challenge, a whole nother culture, really, of people coming up, and they have a different work ethic, and they have a different view of life, and they have which is very interesting to me because, again, I'm kind of caught in the middle of those two, and to see how you're already anticipating how do we shift from the boomers and the aging Xers into these millennials that are going to be the backbone of the future of home health and how they love this sort of technology. They love this Uberization technology and this sort of flexibility that it offers, I think really speaks to that next generation of home health care providers.
Well, thank you, and thanks for having me. I certainly enjoyed it.
All right, everybody. I'd like to thank Joe Russell, our Executive Director, for joining us today.
Anytime.
Like to thank Tammy Ross, the Senior Vice President of Professional Services for Axxess. You can find our podcast on iTunes, Spotify, Stitcher, Google Radio. I think I leave cassette tapes around Columbus, so if you want to find it there, that's fine as well. We update every month. First of the month, you can expect our podcast to come out, and please subscribe to us on any one of those. And probably more platforms than I can remember at this point. You can find us at ochch.org. That's the Ohio Council for Home Care and Hospice. We are the trade association that represents home care and hospice nurses, as well as private duty and private pay companies here in Ohio. If there's anything that we can ever do for you, let us know. Follow us on Twitter at OCHCH Staff. We're on Facebook, LinkedIn, and Instagram. Thank you so much, and have a great day.